Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dulles Simons Family Studio. Delighted to be back with you on yet another rainy morning here in Kansas City. Today is our 325th morning media update. Can anyone here believe that? Can you believe that? Can you believe that?
No.
I don't believe that. That's a lot of morning media updates. And we are really excited about today's program because we have a great guest this morning. Dr. Stephanie Evergreen is a rock star in the world of taking complicated data and turning it into easy stuff to understand, especially with visuals. She is a self-proclaimed data nerd. You know, we love nerds.
We love nerds.
Nerds are
right
cool.
up your alley.
Did you see how he singled me out on that? Data nerd and master graphic designer whose clients include among a list of who's who, including the United Nations, the Obama White House, I love the Obama White House, CDC, City of New York, as well as the Kauffman Foundation right here in our own backyard. Her list of clients is long and impressive, and we're going to drill down on her work environment or the things she's done around COVID-19 in just a moment. But first, Hawk.
Yeah.
Good to have you back in the studio. We missed you.
Good to be back.
Yeah.
A lot of traveling.
I know. You were. How was Colorado?
Colorado was awesome.
Yeah.
The mountains are always good.
They are.
It was
always
rainy
good.
too, so that's good because I got to see the devastation by the wildfires. They still do have some wildfires burning, but not where we were by Rocky Mountain National Park. But just incredible.
Well, I'm going to be out there next week enjoying it too. So with a fly rod in hand.
It was good.
So how are we doing today here?
You know, we are doing okay. We're doing okay. 12 active infections, 5 in the ICU, but all 5 of those are critically ill. 4 of those are on the ventilator and 1 with ECMO. So very ill when you're getting into the ICU at this point. 7 additional in that recovery period, and Hays has 1 as well.
So, you know, we had our CMO call, what is today, Thursday, Tuesday, I think. And interestingly, what we saw is the numbers in Kansas City are indeed trending up. Not like Springfield, but we'd gone from the mid-80s, and the hospitals would always report, up to 134, 131. So, you know, clearly an upward trend. I think all of us are a little nervous about the Delta variant. What do you think?
You know, I think we have a little bit of, again, information from Scotland about Delta variant. You know, we know that it has become or is becoming the prevalent variant circulating right now in Kansas and Missouri. What it showed from some of the early Scotland information was that you probably do have a higher risk of hospitalization. We don't really understand what that means as far as increased transmissibility. What exactly does that mean? Is the virus just more fit? Is it able to evade our immune system a little bit better? Is it able to replicate longer? But also we have to understand that it continues to be behavioral, and there are a lot of loosened restrictions. There are a lot of people getting together doing things, and that just helps the spread of the disease as well. But we do have one good thing about it. Vaccination.
It still responds to vaccination.
That's right.
That is good news. Hey, so big news on a lot of fronts yesterday. First of all, Novavax, the kind of novel vaccine that's out there. I know we're going to talk a little bit about it in just a moment, but the New England Journal of Medicine, they published their phase 3 trial results, and they were outstanding. I think the efficacy was about 89.9, really 90% after 2 shots. Really great data, and also great data against the against the Alpha variant. So, which is the one that originally came out of Britain.
UK,
UK. And so, you know, it looked really good. And I think that's a really encouraging news. In first part, this trial's occurred later than some of the mRNA trials, so it had a little bit more of the different variants in it. And second of all, still retained outstanding efficacy. Third, it's even a new approach. So let's talk a little bit about that.
It's a new approach to the current vaccines, but we've had these types of subunit and protein vaccines in the past. So this is probably one of the older platforms, not as maybe unheard of as the mRNA vaccine. So, but you know, we use these types of vaccines all the time. They've been around for quite some time. Luckily, and again, I think the bar was set very high from expectations by the mRNA vaccines. Initially, the CDC or FDA said we want something just with 50% efficacy.
Think about the back in those days. And now we're like, oh, that's terrible.
Yeah, it's terrible. And now we got 90+% with the mRNA vaccines. This is very high as far as efficacy as well. Again, a well-known platform, well-known technology, but it looks to be very safe and efficacious. And it is one more thing that hopefully hesitant people, if they are not wanting the viral vector vaccines or the mRNA vaccines, will go ahead and get this vaccine.
Yeah, I think that's really important because, as you said, it's been around for a little longer, at least the technology has. It's new to the COVID-19 lineup, and we'll see if it gets an EUA in the United States or not. That could be a little trickier because we've got 3 other vaccines that have, but it looks like it's going to be a good vaccine for the world as well, which is incredibly encouraging. A second thing that has come out is that looking at real-world efficacy, anytime you have a new drug or a new disease, one of the things you have to wonder is, does the stuff that looks great in studies translate into the real world? Because oftentimes what we know is studies are like a perfect environment. People are following up, you're getting phone calls, everything looks so good. But what happens when you go to the real world with the drug? Does it work as well? What we're seeing in some data that came out of the United States predominantly is that the real world efficacy of vaccination in the United States tracks almost exactly with the outstanding results we saw in the studies. And mostly this is about the mRNA vaccines. There wasn't many Johnson & Johnson patients in it, but published yesterday in the New England Journal again, some really good data showing in a observational cohort study that people who have been vaccinated don't get sick anywhere near as often. They don't have to come into the hospitalization. They don't die. They don't have terrible side effects. They're not having a lot of complications. And they tend to shed a lot less virus. And if they do get turned positive, they're not positive for very long. I mean, it couldn't have been better, really.
Yeah, and that supports other smaller studies that have come out prior to this looking at the amount of viral replication. Just as you said, it looks like you replicate about 40% less. You also don't replicate for as much time. So there is that reduction in transmission.
And the final thing just to hit on is that AstraZeneca, some data came out yesterday as well in a preliminary report, not peer-reviewed yet, not published, but suggesting that a 3rd shot of the AstraZeneca vaccine can really boost effectiveness. And that was like, I don't remember a length of time, was that 3 or 4 months after the 2nd shot. So it does space it out a little bit more. It does require 3 shots, but it may improve effectiveness. I'm not sure we have enough information yet to know about the Delta variant in that story.
Yeah, the other thing with AstraZeneca, too, I saw recently they published some of their early mixed vaccine with Pfizer and AstraZeneca, and that looks to be safe and efficacious and with low amounts of adverse events as well.
So I think the news about vaccinations continue to unfold. It continues to look strong, and really there's not, I just got to say this, folks, there's just not a lot of defense against not getting vaccinated, except, I'm going to say it, paranoia. Because, you know, and I understand fear, and everybody has the right to make that choice on their own. I have a fundamental belief in that. But at some point, you have to ask yourself, are you really safer not getting vaccinated when over 2 billion doses of vaccine have been administered throughout the world and people have not died from the vaccine? I mean, it's unheard of. You know what's not unheard of? Dying from COVID-19. And Delta variant is bad, and it's real, and it's bad because it's so much more easily transmissible. You don't want to do it, and you don't want to be a victim of that fear when the reality is safety is right at your elbow, or in this case, at your upper arm.
Yeah, and I think I saw an article yesterday in the Kansas City Star where they referenced Governor Parson, who also said, it's important to get vaccinated, and it's your personal responsibility in doing these things. And
he's moved a long way to do that.
He absolutely has. Good. I think it's a great message. You know, he's looking at his constituents, his state. What is happening in Springfield is just a tragedy, preventable tragedy.
It is totally preventable.
So it is people's personal responsibility, but do that, protect yourself and protect your loved ones.
And if you're young, you're not immune. I don't mean that. That's sort of a double entendre there, but you're not immune from especially this Delta variant. And so,
you mean you're not invincible?
You're not invincible. That's right. Hard to know that, I guess. Hey, we got to go into our conversation with Dr. Evergreen because this is going to be fun. But first, let's see if there are reporter questions out there.
Good morning, Cody Holyoke from Channel 9.
Cody.
Hey, guys. Hey, you were talking about the vaccines, obviously, and vaccination efforts continue, but I mean, we're looking at the calendar. Holiday weekend is almost here, really starts tomorrow. Cases, hospitalizations are rising, as you said. Vaccination numbers, as you also said, are not where they need to be. So what are your main concerns headed into this holiday weekend, a big weekend, or gatherings?
You know, I'll tell you my main concern, and we're seeing it echoed around the world right now, Cody, right? That countries are going back into more restrictive mode. Los Angeles County has done that in the United States. You're seeing it in Britain. You're seeing it in Israel, where there's a highly immunized population. But it's all about the people who aren't immunized. and they're starting to go backwards into having more lockdowns. Some countries have had very stringent lockdowns. Some countries are having no-fly zones now, meaning you can't fly from certain areas of the world. So I think we need to be really concerned. And I'm not saying it's time to do that here in Kansas City, but I'm saying that we may enter into that. So I just urge everyone out there over the holiday weekend to please be safe. And remember, the rules of infection control, whether they're required or not, are the rules that keep you safe, and you can make sure you stay safe. And if you're not vaccinated, you frickin' need to have a mask on.
Yeah.
And if you don't have a mask on, you know, you're throwing the dice in the face of Delta variant. And you know what? Delta is not your friend.
Yeah.
Not talk about the airline here, people.
Yeah, I mean, we are always concerned and on the ready for surges and hospitalization surges here at the health system. You know, what we haven't seen, I think, over the last 18 months is these specific surges from holiday weekends. We thought about it more than a year ago at the first Memorial Day. That open, that wasn't even open, but we knew people were going to celebrate. We haven't seen those surges. I think it's more overall of a continued lessened restrictions, continued people getting together, and continued vaccine hesitancy. And so, you know, I think everybody should have a good time. Do it thoughtfully and responsibly. Do it outside if you can. If you aren't masked, remember, wear masks. Or if you aren't vaccinated, wear masks. If you aren't vaccinated, think about going to get it before the holiday weekend. That is one thing you can do to help protect us, gain some immunity, and help stop the spread of the variants, especially the Delta variant, which again is the majority or most prevalent variant here in the community.
Yeah, it is just so darn important. Don't be a gambler, people. Hey, Cody, one other thing to say. You know, the CMOs were on yesterday. One of the things we should be afraid of is that hospitals are full, and they're full throughout our community. And that's because all the normal stuff is back out there. Again, as masks have come off, what we're seeing is that people are getting sick, they're getting the routine colds, heart failure's acting up, all the things that that would happen to us normally are happening now. And just to say, we're not usually this full in June, but we're really full, and everybody's really full. So if we have a surge, trouble will come a lot sooner this time than it did the last time. So we just got to make sure folks understand that. And that's one of the problems, and that's one of the reasons things went bad in South and Springfield so fast. That's why we're getting Springfield patients in Kansas City right now.
Thanks for the contact.
Any other questions out there? All right. Dr. Evergreen, thank you for joining us. Tell us a little bit about who you are, about your company, your passion for making graphics, what got you interested in this kind of work. Give us a little bit about your story.
Yeah, I'd love to. I wear that nerd badge with honor. I mean, I started my life out as a number cruncher, behind the scenes, big time data nerd. But when it came time to have to communicate that stuff out to other people, to have to translate those numbers for them, I would have to write a report or maybe make some slides. And I was so bored doing that. I just hated it. It was like the part of the work I dreaded the most. And I realized if I was bored, my audience was definitely going to be bored. So I started to think about ways that I could make those numbers more exciting for people. And back in the day, I thought the answer was very fancy 3D pie charts, which did get people looking at my work a little bit more, but it actually caused them more confusion because we can't read those very well. So I started to realize that if we really take the care to figure out how to communicate our data effectively, people will pay attention and they'll get it. And maybe we can cause them to make better decisions about their lives. So that's what I do full time now. I teach people how to communicate their data effectively.
Outstanding. So has the pandemic impacted the kind of work you do?
Definitely so, yes. So first of all, business is just booming here. And I think we've kind of seen that as a trend everywhere, that everybody in the past 15 months has become way more interested in data. I think we've all seen it in the COVID dashboard that's at our county or our state level. Suddenly everybody is a really good graph reader, checking out those graphs every day and seeing those numbers tick up or tick down. And that's translated into a much bigger interest in graphs and data visualization in general, because I think we witnessed over this time that if we do graph well, we can, change behaviors. We can actually save lives. So the interest in data viz has never been bigger than it is right now. And the only difference is I'm just teaching people how to do it from my house instead of flying all over the globe.
Is that more fun just to be able to do it from home? Is that one of those silver linings of the pandemic?
Yes and no. I mean, I don't miss wearing high heels and running through the airport. That's not fun. I do enjoy, wearing my slippers while I'm giving my workshops. It's much better, but I wouldn't mind getting out of here just a little bit.
Yeah,
I miss Kansas City barbecue, to be honest with you.
Yeah, we have the best barbecue. Where do you live? Where are you?
I'm in Michigan, so we were one of the hot spots at the very beginning of the pandemic, and our governor here has done a lot of work in that area. So just thinking about what you were saying earlier about maybe going back to some of the restrictions that we had before, it's something that we're watching for here.
Yeah, you got to do that, and can't let fear be your guide. You got to let the rules and the science be your guide. Yeah. So we have some graphics from a client of yours that I think they give us some insight on the toll of pandemic, for example, on New Yorkers. Can you walk us through these graphics and help us get this information?
Sure, yeah. So the New York City Department of Health has been one of my repeat clients over the years. So we train them in how to make great visuals, and I just love seeing it show up in such a clear way in their reporting around COVID. So in the graph we're looking at here, they're talking about people who have experienced anxiety as a result of the pandemic, and they've broken out that data by race and by neighborhood poverty level. And what I love about this graph so much is that they used bar charts here, a simple chart type, but they're nice and clean, and they used an order to the bars. And the order is part of what tells you the story about how, at the top, if we look at the race ethnicity data, Latina people felt the highest anxiety because of the pandemic. And if we look at neighborhood poverty, there is actually an order there already to the poverty levels, but the length of the bars, the amount of anxiety actually goes right in line with it. So the higher the poverty, the more anxiety, which makes sense. But when you see it in a chart, it's like, wow, that's a confirmation of what might be a gut feeling anyway.
Yeah, and it should be. I'm just trying to figure out who wasn't anxious about the pandemic. I can't believe it. In any population, only 28% could have been. That's just not true. Great. Well, thank you. So I think you may have some other things you want to show us about, for example, the percentage of adults who avoided care.
Yeah, that's another chart that the New York City folks are putting out. And what I love about this one, so again, they're ordering this data by neighborhood poverty, but what they've got here is this benchmark line that kind of shows us the average. And so we can compare like who's above that and who's below that. And I think that it starts to open up more questions for us. Like the people who had low poverty, that wealthiest group that's at the bottom there, very few avoided care because of COVID, which leads you to ask questions like, why is it that they avoided care, that they didn't need care in the first place, which points to a lot of other systemic issues, right? So good data visualization helps us actually answer and ask more questions than where we started.
Yeah, I'd love to sit and kind of sift through that information, because I think it is fascinating to think about who, and we saw that a lot of people avoiding care. We saw the cancer rates jump. We saw in terms of how sick people were when they came in, or how far their cancer was advanced. There's some data out there that suggested it advanced by one stage or some such thing. And then the heart attack data, when people are stroke data that came in beyond the time we could do interventions because they didn't want to come to the hospital. So lots of important information in that one. So talk to us about this one, about financial stress.
Oh, I love this graph so much. So this chart type is a dot plot, and it's not one of the usual suspects that we think about when we, think about the handful of graphs that we might know. And that's why I love it so much, because it shows us how different graph types can help illuminate different stories and help us see patterns a little bit better. So they've got financial stress kind of broken out by a bunch of different metrics, like paying your bill or affording subway fare. And then different racial groups are laid out by these dots. And the pattern seems pretty clear. I mean, that darkest blue representing the Latina population is highest on every single one of these metrics. And black is right behind that. I mean, there's actually a very clear step-by-step pattern in here of who was experiencing the most financial stress along any of these financial metrics.
It is a fascinating thing. You are a data nerd, by the way. I could hear it when you say, I just love these dots. Okay, that's a data nerd. That's good. So here's the real question for a data nerd. I know we have to ask this graph first, but first, the real question is Star Trek or Star Wars?
Oh, Star Wars. Sorry, fully.
No.
I had to watch A New Hope last night with my son. So.
Well, they're both great, but really, for the ultimate nerd, Star Trek.
Yeah.
If you're a Trekkie, you're both nerdy and dorky. That's probably the difference between a lot of Star Wars fans, I think. Okay. So use the Force to tell us about what this one it means.
Sure. Oh, yeah. So this is one of the infographics that the New York City Department of Health was putting out. And an infographic is sort of like a big visual poster. This one could almost even double as a brochure. It's got that like trifold feel to it. So kind of in that spirit, but they're really trying to make this, if you don't have the desire to read that long report that includes all those graphs, this would be your handy shortcut. And what I love about this one, they're doing some of the strategies that we teach in our workshops. If you look at the column chart that's on the left there, they aren't just using some kind of generic title like inequities in New York. They're using a whole sentence that tells us the insight they want us to see in that data. And that's an amazing strategy that you can use. It's a very easy strategy to implement that makes people's ability to understand what you're saying just fly through the roof. So they're doing that really well here, where I get that question from people a lot. Like, I've heard I should be telling a story with my data. How do I do that? And the answer is really easy. I mean, there are lots of things you can do, but a very simple strategy is just to say it in a sentence, like tell people your story and make that part of your graph.
Yeah, that is really, that's pretty cool, and I do like the infographic style of that. It reminds me of some of the cool posters I used to put together for research presentations. I don't think they were really that cool, but yours are a lot more
Not
cool.
yet, yeah.
That's good. Okay, local symptoms, phase 3.
This is with her Novavax.
Yes.
Yeah, with the Novavax. Talk to us about that. This is kind of cool.
Yes.
And I wanted to talk about Novavax before you got on, because I know you've done some work for Novavax. I know, so I didn't want people to think we're going to talk about it because you were on. We're talking about it because it got published yesterday in the New England Journal, so that's a really big deal. So
Happy coincidence.
Yeah, it is a happy coincidence. So is this the one that made it all the way to Dr. Fauci? I'm sorry, was that the one that had made it all the way to Dr. Fauci?
It did, yeah. And I was just going to say, it's been such a joy to work for a client who is out there in the news all the time. I see stories about Novavax everywhere now, and it's just so fun to see my clients put good stuff out there. This is a dumbbell dot plot, so not dissimilar from the one that we saw from New York a little bit ago. But the idea with the dumbbell dot plot here is that it can help us compare the gap between two groups. So this is what we're seeing, what their data were showing us in their trials about the symptoms people had between people who got the placebo and the people who got the vaccine. And so the bigger the gap between these two dots, the more the gap between the two groups who experience those kinds of symptoms. The closer the two dots are together, it means that pretty much the two groups experienced the same thing, and there wasn't a very big difference, which means that people who get the vaccine don't really feel any differently than people who got the placebo. And what I love about this particular graph, I mean, I guess we all kind of experienced it ourselves, but yeah, everybody got a little pain. Everybody got a little tenderness when we got those doses. But so did the people who were in the placebo. I mean, maybe more got it who had the vaccine, but the people who get the placebo, just anytime you're getting a shot, you're going to probably get some tenderness and some pain. Yeah. So I think it kind of makes sense for us. And there are a couple places in there where we're only seeing like a gray dot. That's the placebo, which means only the person in the placebo had a severe symptom there, which is just fascinating for me as a data nerd.
And I would just like to point out that when you get to severe and life-threatening, there just aren't a lot of dots and no space between the dots. Yeah, I like that a lot. Because what it's telling us is it's safe.
Yeah, exactly. And that's a case where the lack of data is actually part of the story.
Yes, actually the best part of the story, perhaps. So, okay, so now, so first of all, tell us what you did with the Obama White House.
So I don't really know. We do a lot of I've got books out. I have online courses and things like that. So as far as I know, that's the information that they used. So I didn't get to talk to Barack Obama or anything like that. I just found out that they love my work, and that was enough for me.
Yeah, that's very cool. And so we've got some information up there about to learn more, to talk with how to get to Dr. Evergreen and visit and help her make your data sing. I like that. Where should people go if they want to learn how to take boring data, that's what I talk about or try to present, and make it sing? So Stephanie, talk to us a little bit about that.
Sure. Yeah. So I've got 3 books that you can get to them on my website, but they're also on Amazon if that's your style. You can just search my name there. But I do a lot of blogging, so a lot of free tips you can just get right on my blog, and I end up posting those tips on social too, so you can connect with me on any of those platforms as well.
Very cool. So Dr. Evergreen, as you look back on your work related to the pandemic, what are some of the important things that you've learned about the pandemic and about the response of people to vaccination with Novavax and others?
Well, I think what we've seen writ large is that visuals change how people feel. And I can tell you a little bit about a study I saw on this, not a study I participated in, but the researchers were surveying these study subjects every week on their feelings about wearing a mask, their feelings about social distancing. And then like maybe 6 or 8 weeks in, half of the group got the same survey questions, but just with this infographic, and you've probably seen it, but it's like 2 people talking where their spittle is like different colors, and you can see their spittle flying all over each other. And then what happens when one wears a mask and what happens when they both wear a mask. So same questions, just half the group got that infographic. And the responses from that group after that, after they saw that, were drastically different. And they actually saw the biggest shifts happening in the people who had previously been oppositional to mask wearing. So I think that shows us that visuals can change how people think, they can change how people behave, they can help us save lives.
So we clearly need more visuals out there because we need to get more people vaccinated. So go to work. Let's go. Come on. All right, Jill, let's see what questions we have out there from the community.
Yeah, we've got a few, and I'll start off with the topic because we do have a couple on that. Dr. Evergreen, Tina wants to know that when you're working with other clients, and I think she's referencing your work in New York, do you see the same kind of data across the United States, or would you expect to see the same?
In public health, we do tend to see the same kinds of patterns because everybody there is sort of tracking the same thing. And before the pandemic, I mean, right now in the past 15 months, everybody is just looking at COVID data. But before that, I also just saw some broad similarities in terms of what people were looking at in different public health departments. A lot of stuff back then was about like STDs, a lot about racial disparity. That's obviously still a trend with COVID too, looking at that data really carefully. So yeah, we do see some consistent patterns.
And Sam was wanting to know, what other kind of COVID-19 research or data are you doing? Can you talk about it?
Yeah, there's not a lot I can talk about, actually. The NDAs with Novavax are pretty significant. But there is a little bit more to be done. They put out a fact sheet in the past couple of weeks that includes a few more of the visuals that I made. One is what we would call a waffle chart. So a waffle chart is just like individual little squares. And it's a really good chart choice when you have a small number of something. So we were using that chart type to talk about the variants and how there's only a handful. So it can be kind of misleading to put them in something like a pie chart or a bar chart when you only have like 9. It's better to use something that shows each individual variant as its own little square. So we would call that a waffle chart. And you can see an example of that in the fact sheet that we put together.
Hey, Dr. Evergreen, really quickly, tell us your background a little bit more. What did you study? Because I think people are probably, this Dr. Evergreen, what is your doctorate of? What does she do? Because you clearly love data. You clearly are brilliant. So talk to us a little bit about what's your story?
Yeah, sure. So my PhD was in interdisciplinary research, which is a mouthful. People probably don't recognize. It basically means I'm a big-time data nerd. And I studied how to conduct studies in every kind of industry. So the work we do now is still interdisciplinary, where I work with like county-level public health departments all the way up to Facebook and everybody in between. Once you know what data looks like, it's kind of easy to recognize it in different scenarios.
Oh, that's very cool. How to do what you do. That's kind of neat. All right.
Marty has a question that kind of dovetails with what you just asked, and it's, do you have a favorite subject? I mean, is health your favorite subject? Do you like government stuff?
Football, baseball, name it.
Yeah.
Yeah. Well, I don't necessarily have a favorite subject, but my favorite people to work with are those who are out there trying to save the world. So sorry, it's not going to be sports. But it is people in public health, people who are in education, people who are out there trying to improve quality of life.
Yeah, that's a good person to work with. We're all about that.
And, well, we're going to go to some COVID questions now.
Don't worry,
but
we'll be able to
Robin's-
meld all these together. I've got some questions for her.
Numbers is her favorite subject.
Yeah.
But I did want to share that Robin said, how about creating graphs, charts, tables to reflect local data during the morning update? So
Yeah, well, if you can hire Dr. Evergreen, let's do it. I'm all about that. We could give her her own segment on the program.
Oh, man.
She wants to do that.
Yeah, she
I'm
can
sure it's
explain
free.
this data,
Yeah,
right.
I'm sure it's free.
Yeah.
And we have so many commercials, so it'll be, we can pay for it.
Let me do a couple of COVID questions, and then you can.
We'll mix it all up. Don't worry.
Yeah,
Okay.
I know. This is you guys' fun area.
This is where I drive people crazy because I go off script, everybody.
Yeah.
Just so you know that. I was told earlier today that the entire team here is on Xanax because of my style. It's just great. They love me, though.
I
Maybe
was
not.
teasing.
Yeah.
Okay.
No, she wasn't.
Yeah, and maybe I wasn't. Okay. Sandy wants to know, I just saw the U.S. has stopped air travel from UK. You kind of mentioned this. And into the U.S., and that happened overnight, stating that it's due to the new variant. Could you speak more to that, what you think's driving it and what you think we're going to see?
Yeah, I think it's the fear. It's just exactly what we talked about at the kickoff of the program today, Hawk. When you have things that are in different parts of the world, you don't want to import it into your part of the world, and you're trying to stop the spread. Now, honestly, when it comes to the UK and the Delta variant, we're way too late for that.
Yeah.
So I'm not sure about that. But the Delta Plus variant, maybe some other additional variants are beginning to pop. That may be some of what they're thinking. But I think you're seeing it all around the world. It's not just specific to the United States now.
No, but I think if people would get vaccinated, we could prevent this.
Yeah, just get vaccinated.
So, there are these public health measures and restrictions that they're doing now. Again, we said we don't want to have to go back to the large restrictions, the mask mandates, the shutdowns, things of that nature. We can protect ourselves from these things if people would go out and get vaccinated.
And here's what we know. In Springfield and in Kansas City, almost everyone who has hospitalized has not been vaccinated. And amongst those who are dying, they're not vaccinated.
No.
And amongst those who are at risk, not vaccinated. There's a very simple thread here. It's very simple. I don't understand the resistance still. And maybe that's my own fault, maybe my own frustration, and that's just part of the deal, I guess. But at the end of the day, billions of doses have been given. Very, very rare deaths occur.
Yeah.
And people die all the time from COVID-19, and it's getting younger, and it's getting more dangerous because it's so transmissible. So why do you still not want to get vaccinated? The evidence is overwhelming, Hawk.
Yeah. The vaccine hesitancy, again, multifactorial. Well, I don't want to be a guinea pig. It's not, what are the long-term effects? Just as you said, the evidence is overwhelming. The safety and efficacy is there for these vaccines. There is still hesitancy. I don't want to be experimented on. These aren't experiments anymore. These are well-proven prevention measures, these vaccines. There's also the obstinance and the opinion and the misinformed opinion or getting misinformation, because we know there are large misinformation campaigns out there. It is the continued opinions to search for the narrative you want so that you can continue to be obstinate, not believe in the actual reality of what is going on with the infections around the world and with the overall benefits that these vaccines provide as well. So there are very many reasons. It is multifactorial, but we have to keep moving forward, giving these messages, getting all of these hesitant or vaccine lazy people to get vaccinated.
Okay, not that we feel strongly or anything.
Right.
Dr. Evergreen, do you have any thoughts on that topic?
I agree with you 100%. Let's all get vaccinated. As soon as they said that our kids could, I signed my kid up right away and took him down to Walgreens the next day and got him a shot in his arm. And carrying my mask around again because I don't want to get the Delta variant. I mean, I think that we had to continue to watch those numbers. And just when we thought we could relax and stop monitoring the state's COVID dashboard, I'm right back on it again.
Yeah, you have to be. I think that's the right thing to do, and we're seeing the upticks here. And, Missouri's one of the least vaccinated states in the country, so as a result, it's one of the most vulnerable states in the country. Vulnerable states in the country. Vulnerable states in the country. Vulnerable states. Uh-oh, there's an echo. Got it. Okay.
It was worth repeating, I guess.
Yeah, well, because it should be repeated. It's worth
Joy said that she saw a report on Case TV5 this morning that said that we had received 8 COVID patients transferred from Cox Health Center in Springfield. I can give a little clarity around this because I monitored this interview with Vice President of Quality and Safety, Dr. Tim Williamson yesterday. What he actually said, Dr. Stites, is that we received 8 transfer requests and we got 2 COVID patients. Can you help explain the difference between a transfer request and the fact that we maybe only got 2 that were actually COVID?
Yeah, the problem is we don't have beds. I mean, folks, this is why I keep saying to you, we're in a greater danger zone in terms of the risk because in some ways than we were before, because we don't have beds. And the reason you don't take patients is if you don't have a bed because we're out of ICU beds, and that's where we were. And so we can't take every single transfer request, and then people have to go find another hospital to try and transfer them to. And on our CMO call yesterday, that was what we were hearing. Guys, everybody's full, and it's not like you can stop taking care of the patients who are already here and sick. So, Hawkeye, this is an important moment. If people aren't going to get vaccinated, and these variants are going to be out there, and again, the variants are going to select for the people who aren't vaccinated. They're going to get sick. They're going to be hospitalized. Yeah. We could get in trouble.
Yeah, and I think we should state, too, all of the transfers are not just for COVID. They are for things that could normally be taken care of at these other hospitals, but since they are overwhelmed, and we saw this, I saw this a few months ago with one of our rural Kansas hospitals. They just didn't have the bed or the resources to take care of a non-COVID issue.
Yeah, stroke, heart attack,
right. And so they aren't always for COVID, but at that local facility, wherever you're talking about, if COVID is driving up the numbers where your capacity is exceeded or at a maximum, then you aren't going to be able to take care of those normal routine things that you could, so you have to transfer to other places.
Yeah, here's what I know. If we got up to 130 COVID-19 patients right now, like we were at one point that are acutely ill, that's really going to be bad, because that means the whole city is going to be on fire. Yeah. And I don't think we will, because we still have a percentage of the patients have been vaccinated, or the population has been vaccinated, so I don't think it's going to be that bad.
Yeah.
But it can be bad. And it's all about, and the data is clear, the crisis in Springfield is driven by the number of unvaccinated people down there, especially coming from the counties where the vaccination rates are really low, like in the 20% range or less.
It sounds like Governor Parson also agrees with that now.
Yeah.
I know him. He's a good guy. He's a good sheriff, and I'm glad to hear him say that. Yeah. Carol wants to know, has a gamma variant been identified anywhere?
I have heard a little bit about the gamma variant.
Is that the P1?
It's brand new. Yeah, I think so.
I think initially we had some identification of it in Kansas and Missouri a few weeks ago, but again, since late May till last week, we saw that the Delta variant had increased from about 10% of the sequenced isolates now to 75% or more of the isolates. So
I think it's helping drive down some of the other variants because it's so transmissible that it prevents some of the less transmissible and potentially even more dangerous ones. That's not to say you want to get Delta. You don't have to get any of them if you're vaccinated. You'll be safe. But if you choose not to get vaccinated, then yeah.
Joshua says he read something about a Delta Plus variant. Can you explain what Delta Plus means?
Yeah, the Delta Plus it has, I haven't reviewed it in a couple weeks, originally identified in India as well. Just other mutations or substitutions in the amino acids, within that spike protein. Again, we haven't seen the explosion or the prevalence that we have with just the original Delta, but that is one thing that is continuing to be looked at and investigated.
One of the things I know is that this alpha, gamma, delta thing, these are categories, and within the categories there can still be more different when that's kind of the Delta Plus story. And it's not enough to make a change to the category because it's a more minor modification, but it can still make the virus more dangerous, which is what I think some of the concerns around Delta Plus were, that perhaps could be even more dangerous.
Okay, and Lindsay wants to know, are any of the patients that are critically ill unvaccinated who had COVID prior?
Yeah, I don't know that off the top of my head.
We don't know about reinfection.
And one of the problems with that question is that we may not ever know if they'd had COVID-19 prior. And the lack of that history doesn't mean they didn't or it did. It just means you may not know, because some people have been more asymptomatic the first time. So it's actually a hard question to know the answer to.
I wonder if at the heart of that question, if she's thinking,
what she's thinking is
out that people believe that if they've had COVID before, they're protected.
That it protects you. And the reality is it does offer some protection, but nowhere near as effective or as broad or sustaining as the actual vaccination does. That's what really makes the difference.
Okay, and Holly, we'll get your question tomorrow. Leanne's going to get the next to the last question, because we
Okay.
have one question for Dr.
Yeah.
Hawkinson before
All
we
right.
end. Leanne's question is actually for Dr. Evergreen. She wants to know who should be using more data viz, and how could they be using it to help those who aren't vaccinated yet get shots?
Oh, I love that question. I think public health in general. So, I mean, we know that a lot of state and county folks felt like they had to get data out there very quickly. So they kind of threw together dashboards, but they're not all of the best quality. And I feel really bad for those folks because I know they were really put under pressure to make something happen fast. But now is a really good time to refine those dashboards and make sure that they're communicating the data as effectively as possible, because that's the stuff that the media picks up and puts in their news programs that are getting in front of everybody's faces. So while journalism is beginning to be way more interested in data viz, they're looking for source material that they can use. So I think the public health departments are going to have to step up their game just a little bit more right now.
Mm-hmm.
Yeah.
Great answer.
And the last question today is from Judy, and she wants to know, Dr. Hawkinson, how did your son do in the soccer tournament yesterday?
They fought valiantly. They lost in the Midwest Regional Final to a team out of Detroit, the Nationals, who I think were ranked like 4th or 5th in the nation. So they lost 4-2, but fought well, and
pretty
get
darn
it
good
next
to
year.
make that. It's still pretty darn good to get that far.
absolutely.
So, hey, this has been a great 325th episode of the Morning Media Update. Tomorrow, it's Follow-Up Friday, and we're going to answer your questions, including one that many of you have asked lately. What is the future of this show? We'll tell you about that tomorrow. I think you're going to like our answer. Anyway, we hope so. We know that the COVID crisis isn't what it was, but it's still very real, and there are a lot of health issues we need to explore. I wonder what that could mean. Let's go around about final thoughts. First, Dr. Evergreen, again, first, thank you for being on the show. Thank you for trying to make data clear and understandable so that people everywhere can look at it. I love the presentation of just the information you had earlier, because when you can show data and it makes you want to think about it, then it's been a success.
Absolutely. Thank you so much for having me on the show.
Final thoughts from you today? Any final messages?
Let's just keep this. Let's just keep this train going and keep this momentum going, and let's all get excited about how we can get data viz integrated into the work that we do every day.
Yeah, awesome. And let's all go get vaccinated. Hawkeye.
Yeah, it's been a lot of shows, and we know that Jill works extremely hard at doing this. Anthony, Logan, everybody, just as they are really the motor behind all of this. So
Yeah, we're the pretty faces. You're the pretty face. I'm the nerdy face. Go ahead.
But, there's been a lot of talk, concerns about variants. Is this more transmissible? Is it more fit? Does it evade the immune system more? What we do know, in the best evidence so far, the best published data, is that all of these vaccines protect against that spectrum of disease that any of these variants cause, especially severe disease and hospitalization. So we have seen what's gone on in Springfield. You talked about how our CMOs around the city have talked about how they're increased in census in COVID patients. But the way to prevent this is to get vaccinated. If you know people who are not vaccinated, please talk with them. Ask them to talk with trusted sources, but go get vaccinated, because this is the way that we can keep ourselves safe, our community safe, from the 4th of July weekend and beyond. And if you have children, please go get them vaccinated. We know that things are going to be much more like 2019 in this coming fall with sports like football, soccer, volleyball, all of those things. If you want your children to be able to participate in those things, in those extracurricular activities, please go get them vaccinated. It will help. It will help protect them against long COVID. It will help protect them against the multi-system inflammatory disorder as well.
325 episodes is a lot of shows. I remember when we started, we were sitting around that telephone right there, and Hawkeye and I would be crowded around it, and reporters were all in the room. We did everything wrong because we were just building the airplane while we flew it. We knew that airplane, it kind of sputtered. Maybe some days it could get off the ground. Some days it had a little bit of hard time, and some days it lacked a few parts. But over the episodes, we've learned a lot, and we've learned that the rules of infection control could keep you safe, which allowed that airplane to fly a little higher, to fly a little stronger. And then we learned that there was vaccination. I remember the program where we were talking about it right here, and we said, game on. We're moving from defense, all about infection control, to offense and getting to say, stay safe. That was a great moment.
Yeah.
And we know that we've learned more and more. We've learned about the safety of the vaccine. And our plane has gained altitude. It's become a jet. And in fact, it can soar. And you can soar. And you can do it by staying safe. And the choice is really pretty simple. It's not hard. All you have to do is get a vaccine. And then you can say, let's fly. We're here tomorrow. We'll see you then.